is there any, I guess we're trying to just to provide, I guess, a little more specifics for people. I guess, is there anything you did to like kind of manage this learning curve that we constantly are on?
You know, I don't think there's anything like a secret.
Yeah.
You know, it's honestly, I think you're gonna have bad days. You're gonna come home, you feel like you did a terrible job. Your presentations were terrible, or things like that. But you just get up the next day, you try again,
Yeah.
and
Yeah.
you just have to get used to that. And sometimes you'll come home and you're like, wow, I'm a superstar. Like
Yeah.
I know everything, and then the next day you realize you don't know as
Yeah.
much as you thought you did. And I think just getting used to that, and not being too hard on yourself, and then just knowing your like limitations and things like that. But more specifics, like again, you pick this up as you go. But for admissions, like if you always want to see if the patient was discharged like last week,
Yeah.
and then you can just read that discharge summary and kind of know exactly what the patient's story is. And again,
Their
like
meds
vital
are.
signs. One of our attendings, I'm going to butcher this, but he's got like I think 3 rules. It's like vital signs are vital for a reason, and then I forget one of them, but the other one is all bleeding stops eventually. Hopefully, you never have to get to that point. But yeah, like knowing the vital signs, that's like the important thing. You want to
Sure.
what are their maps? What do their initial labs look like? How sick are they? What have they gotten in the ED? And again, you pick that up as you go. And the great thing about medicine training is that you're never alone. There's a senior resident,
Right.
there's attendings, there's APPs, NPs, whoever's on your team. They're always there to also help. And I think that's great as a learner. You always want to know that someone else is there to answer your questions, or because at some point, it depends on where you practice, there might not be someone to answer that question. But at this time, like the point is of us learning how to manage this stuff, so it's good to have a team.
Yeah, I think definitely. I think that's a big thing. Is you said there 2 things is like knowing your limitations and knowing when to ask like for help, or like, I mean, that first month, like you just don't know this stuff, and like
Yeah.
anyone who expects you to know that stuff is just a jerk. I mean, like if they expect you to know how to like put all these orders in and all that's just like unreasonable. So I think knowing your limitations, and then like I think just leaning on your senior residents, or if you're with a fellow or somebody, or or if you're by yourself with the attending, like I think even if I think not being afraid of looking stupid, I think you just have to let that go out the window. I mean, I think you just gotta, if you don't know something, you don't know it, or you don't know how to do something, you don't know how to do it. Like and no one should, especially those first few months, no one should fault you for that. There's still things I don't know how to do.
Yeah.
In the ICU, I was like, my first week in the ICU, I was asking a lot of questions of my senior resident, just because I didn't know, like, is this appropriate in the ICU? Like, do we do this? Like, so I think leaning on your senior a lot, and that's true. I think no matter what specialty you're in, surgery, medicine, EM, things like that. So I think, not being afraid to ask for help, and knowing, if you're in, I remember like the first month of wards, I had a patient that was visibly crashing. Like, they were going into cardiogenic shock as I was examining them. Like their extremities were turning cold. They were desatting, their blood pressure was dropping. My senior resident was off. So I called, it was in the ED. So I was able to grab one of the ED attendings that I knew there. But I called my attending, and she was glad. She's like, I'm glad you called. And so it was like, you can't, especially in the first couple of months of internship, you can't be expected to know how to deal with that. You know what I mean?
Yeah.
And so like, that's why you call, that's why there's these, that's why it's not just an intern by yourself. Like, you've got people to rely on. So
yeah. And the attendings are on teach service because they want to teach.
right. Yeah.
So I have yet to have an experience where I asked the attending a question or called them to because I was worried or I didn't know something. And there's never been a time where they're like, why did you call me? That's just, that's not why they're there. They're there to teach you. So they're going to answer your questions or explain, oh no, it's totally fine. You don't have to worry about that. Or they'll be like, oh, thanks for calling me. Let me come see the patient.
Yeah.
I think the other thing is, and first month is probably impossible to do this, but as you go through the first year, is finding like appropriate resources to learn about the specialties. So for example, like medicine, like as an intern, you'll get access to Mix app or whatever resource your program offers. I think a couple different ones, but also like finding your go-to resource. So like everyone uses UpToDate. That's great. UpToDate is what I use for drugs all the time, like dosing,
Sure. Yeah, me too.
renal adjustments, and or even like reviewing the mechanism or pharmacology, like how long is it going to take for this drug to kick in? And
Right.
it's like, oh, I'm going to give this orally. Oh, it's going to take an hour for it to work. Okay, maybe. Um, and then, but what I started using was Dynamed, which I think was like really uh, emphasized at Toledo, but I never used it. I'm
Sure.
pretty sure we had access to it. And I was like, oh no, UpToDate's the best. And then I started looking at Dynamed this year, and it's perfect. It's very concise.
Yeah.
There's bulletin points, and then they go into detail if you scroll farther down on each page. But you get to figure out like dosing management, workup, things like that. And for critical care, EM Crit is there's a website, a podcast,
Oh yeah.
and they have that online book. So just finding those resources quick, having a reference guide. And the other thing is one of my attendings first month told me, like, if you're interested in academic medicine, use I think it's called Evernote. Have you used Evernote?
I've heard of it. I don't think I haven't used it.
So I started using it more often now, but it's basically a note-taking website or app, and you can pay for it or you can use it for free, depends on how many devices you want to use it on. But it organizes your notes in notebook like format, and then it's searchable, and you can have it on your phone, your laptop. So what I started doing is either making my own tables or just copying and pasting like dosing for sedation and like side effects or whatever it is, and then you can quickly look it up on your phone anytime.
Yeah.
Because you have all these great resources, like you have 20 different ways you learn about hyponatremia, and maybe each resource has like one thing you like the most.
Sure.
Then you have to go back and look at those resources, find that video or find that segment. But I started just copying and pasting each individual thing into this Evernote thing, and it's been really helpful.
Yeah, I think that's a better way, because I remember on ICU the first week I didn't know any of these drugs like for sedation, and so I actually made note cards like the old fashioned way and kept them in my like white coat, and like pressers and stuff and like what the side effects are. But like if you have like an electronic resource where you can keep that stuff handy, and I think the searchable thing, that's really nice.
And you type in whatever it is, and I don't get paid by Evernote, so
yeah, we don't have a financial stake in that. No, I think that's great. Yeah, I think asking your like upper level residents, it's like, obviously I think that one an attending told you too, but I think asking them again for help, like what are good resources.